Guys, welcome to Premier Talks. My name is Jahara Osman. We have Dr. Afari here with us, and today our topic is IV vitamin therapy. And if it's your first time here, welcome. If you've been a part of our journey, we thank you for always sticking with us. You can always hit the subscribe button to keep getting updates about Premier Aesthetic Clinic. Everything we do here, we like to share with you guys. Okay, so let's get straight to the point. What is IV vitamin therapy? IV vitamin therapy has become very popular these days. We've heard a lot about it. When you go on Google, you hear a lot of different opinions about it. Some people call it the Holy Grail. Some people are skeptical, and we always look at things from a different perspective, but it's always important to talk to the expert. That's why we have Dr. Afari here today. He's part of the Premier team. He's a pharmacist. He is from Zyclus, right? If I'm saying it right. Mm-hmm. Okay. All right. So he's both certified in Ghana and in the United States of America. And he has been doing this for, I think, about a decade or so.
20 years.
20 years. Wow. Yeah. So definitely he knows what he's doing. So yes, he's a compounder. And if you don't know, compounders are pharmacists that actually make the medicine. So we are lucky to have him here today for free, I guess, to give us the insights about IV vitamin therapy. So Dr. Afari, can you tell us what is IV vitamin therapy?
So before I talk about IV therapy, let me talk a little bit about what I do as a compounder. As a compounder, we tailor make medicines to suit a patient or a client. So when you move to IV therapy, when we encounter a client that has special needs of IV or therapy, maybe wellness therapy, what we do here, or what I do as a compounder, is to put together the vitamin need of that particular patient. A patient might be low on vitamin D, might be low on vitamin C, or might be low on glutathione, or might be low on any vitamin at all. We are able to put together the vitaminic needs of the patient, but no.
So, Dr. Afari, when we talk about IV vitamin infusions, we all know about vitamins. Since I was a child, I've been taking vitamins, vitamin C, we all know. But this new infusion, when we talk about infusion IV, you're actually getting a drip inside your body. And, when I was a child, I always thought that you had to be sick to get a drip, and then now I hear like, oh, you can get a drip on an IV when you're not sick. So it becomes like something that, you ask, do I really need this? Or even if I don't need this, what's the difference between taking the oral vitamin and taking the IV vitamin?
Okay, so the oral vitamins are everybody knows about oral vitamins, multivitamins and all that. But sometimes when you are aging, you're not able to absorb well. When you are sick or when you have all absorption syndrome, you're not able to absorb well. And so in that case, you have to tend to IV. In the hospital, those people who come and then they're not able to eat, they're not able to tolerate oral medications, we put them on IV. And so we normally take care of clients that are not in the hospital. They just need to boost their vitaminic needs. So what we do is, in order to boost the absorption, the bioavailability of their vitamins, we normally want to give the IV so that we get 100% absorption. The oral preparations, normally sometimes you get 5%, sometimes you get 10%. So going the IV way, we are sure that whatever we are putting in the vial, everything is getting in there. So that's why we normally want to do the IV, so that we are sure that all your specific needs, everything gets into the blood stream straight away. So that's the difference. We are able to get more in there without having to compromise whatever eventually gets into the bloodstream. Are you getting me? So that's why we want to do the IV so that you get your actual need for whatever you need to be well.
So, as an individual, um, how would I know if I need this IV? Maybe I may be experiencing some kind of a fatigue. I may be experiencing, low metabolism, or, I'm gaining weight, or anything, just general, not any kind of sickness that probably will put me in a hospital, or something that makes my life a bit discomfort. How would I know if this vitamin or IV vitamin can be a solution for me? And then how do I know what I need? Do I need to see a doctor to be able to tell me I need this, or I just walk in and say, hey, give me vitamin C or give me vitamin B? Or
Okay. Some doctors may recommend that you go for IV therapy. So sometimes when you go to the hospital, they will actually put you on IV. And I know some of the hospitals have been actually doing whatever we're doing. But you don't really need to be in the hospital. As we grow older, our water level just decreases. We get more fat and then less water. So naturally, as you go, your hydration level goes down. It affects your skin, it affects your metabolism, and it affects your weight. So in order to bring everything down to normal levels, we need to actually hydrate you and then be able to give you some of these vitamins that you are lacking, that you're unable to absorb into your body. So no, you don't need to. You naturally would need hydration therapy as you grow older, because to minimize the wrinkles on your body, and then for you to look a bit younger.
okay, so let's say what types of vitamins are there in this infusion? Like, what goes in there, and are they safe? What level, what amount are safe? Can a person overdose on vitamins? I mean, these are some of the
Not really.
questions
You don't. So there are two kinds of vitamins. We have the water soluble vitamins and then the fat soluble vitamins. With the water soluble vitamins, vitamin, so you just take it, and the body takes whatever it needs, and the rest actually goes out through your urine.
Okay.
So you don't really overdose. You take a lot of vitamin C. You see people take vitamin C 1 gram, even 2.5 gram for infection and all that. They take it, and then the body takes whatever it needs, and then you urinate there. So most of these are mostly water soluble vitamins, and then you take, and then it goes away. So you don't really overdose. And then we're giving you vitamin Bs, and then vitamin Cs and vitamin D. So it depends on what your vitaminic need. We just calculate whatever you need. But if you get more, your system just clears the rest for you, so you don't really overdose. And we are here to make sure that you don't overdose, actually.
Okay. Okay, so Doc, we want to find out what are some of these vitamins, and how do they benefit? What kind of benefits can a person get from it? Like, I've been here, and I know a bit about vitamins, but when we come to IV vitamin therapy, I've had, some vitamins that I've never even heard the name
Right.
before. And then, I know that there's a lot of, vitamin Bs, there's B1, there's B6, there's B12, like which one, which is where it's coming?
Okay.
Can you tell us a bit about the types of vitamins that is used in this IV vitamin therapy and the benefits it gives?
Thank you. As I already stated, we are trying to move from the oral vitamins to the IV vitamins, because the IV vitamins gives us more bioavailability. We can actually put whatever we want to put in the bloodstream to get the desired effect. So some of the vitamins that we've actually compounded and then used for our patients. In fact, every vitamin can be compounded and put in our patients. Some of them we use IM, that's intramuscular. Some of them we use IV. Most of the time we do the IV, that goes in straight to the bloodstream. And then some of the vitamins that we have actually compounded and put in there, the most popular one is the vitamin Bs. Almost all the vitamin B, B1, B2, B6, all of them. Most of them actually helps to improve your metabolism. And anything that helps to improve your metabolism actually helps you to lose weight. Because when you improve your metabolism, you burn energy, and then that leads to weight loss. And then we've also done the vitamin C's. Vitamin C is also very good to boost your immune system and also good for the skin. We've also done glutathione. Glutathione is an interesting one because we've actually used in cancer when we getting drug side effects in cancer. We use that as an antioxidant to mop up all the drug side effects, the chemicals that are in there. So that's what we use in the cancer therapy. And so what it does, it's a very, very strong antioxidant. And so it mops up all the free radicals, all the stress molecules that are in your system. So when you are distressed, you look fresh and you look better. And
So, not to cut you off, I've heard that it's being used to kind of boost the immune system of AIDS patients too.
yes, it does. It does. And in fact, I talked to some doctors at Confanoche for us to use some of glutathione to help some of the AIDS patients, because when they are very sick, their glutathione level goes very, very low, and that's what makes them look, a certain way. They don't look good.
Healthy.
So if you're able to actually put glutathione into AIDS patients and cancer patients, it helps them to look better. Their skin looks, they glow and all that. And so, but the expert that I've talked to, normally they don't want to do IVs for HIVs because of the potential infection transfers. So they've suggested that we do maybe sublingual glutathione for them, so that they won't have to be injecting them. But we normally deal with normal, healthy patients, and that may have low glutathione levels because as you age, your glutathione level goes down. So we try to replenish so that the person will look better and hydrated, and then look younger. So that's the glutathione. That's an interesting one that is being used all over the world. And also we have the NAD. NAD also is it's a very, very important molecule in the cell, and so it helps the cell to regenerate itself, and helps people to look a bit younger. And it also is used for alcoholics, alcohol dependent patients, and so to help them withdraw, because withdrawing from alcohol can be very, very difficult. In fact, it can be used for almost any withdrawal.
So how does it work? When you take the NAD, you don't feel like taking alcohol, or it kills the because like something like naltrexone has been approved to treat alcohol abuse.
Yes.
Because naltrexone actually gives the patient it takes the effects of the alcohol away, so then their mind does not enjoy the alcohol anymore.
What you're trying to say is that it actually curbs the cravings.
The cravings,
so
yes.
that's exactly what NAD does, and then naltrexone.
Wow.
So people withdraw, and then they feel like going back for the alcohol. So NAD helps to curb the cravings, so people don't go for.
So that means like when you have alcohol dependency, or you're alcohol misusing alcohol, you can actually take it, and then when you take alcohol, it's not going to hurt you, right?
No, it's not. It's just a normal. NAD is part of the cell. It's a natural molecule that are in the cell. But most of these vitamins, as you grow older, their levels go down. So a child wouldn't need it. But as we grow, levels go down, and so we look more wrinkly and all that. So this is just to replenish the molecules that we used to have when we were younger, and that made our skin looks good and all that. So we're just trying to replenish them.
So Doc, the other time I was reading about this NAD, and then you see when you talked about cell regeneration, I don't know if I'm right. I read somewhere that when everything we do, right, like let's say your typical morning routine, our brain actually adapts to it. And then there's a certain part of our brain that knows that we wake up in the morning, this is what we do. So sometimes it becomes like a habit. And then the habit becomes like fixated on the brain. And so that is the same thing that happens with people who are like, who have OCD, that's compulsive disorder, people who abuse drugs, people who abuse alcohol, because the certain part of your brain, it's like, it's what is calling for it. So now the NAD, what it does is because it's regenerating those cells, like it's like kind of resetting your whole system back to like reboot system. I mean, I don't know if I'm right, but
you're right. So when the cell is rejuvenated, it just works better, you know. So NAD, that's a basic molecule in the cell. What is doing is improving all the metabolic processes in the cell. It rejuvenates, and then for some reason it's also curbing cravings. And then you're getting cravings from food, not only alcohol actually.
Yeah.
So it's curbing cravings from food. So when these are all put together with the vitamins, the cravings that is curbing helps to get you to lose weight. And at the same time, it's improving your metabolism to be more energetic. So this synergistic effect that is
like
causing for you to look
grail.
like a 12-year-old. Are you getting me?
Now I see where all there's a whole craze about it where everybody's talking about NAD, NADH, NADA plus, and then it's like people are taking it actually to help them study, because they say when you take it, your brain becomes, you become like, your brain picks up things faster. So it became a thing. But yes, that's a good one.
Yeah. When every cell in your body is working better, almost everything works better. So I'm sure your brain also works better, and then you become more energetic.
Okay.
So more about the NAD. NAD in general has been approved by not approved by the US FDA, but it's the US FDA has added that NAD onto the compound as monograph, so that we can use it for addiction, general addiction.
Okay, so not just alcohol.
Not just alcohol.
Okay.
Because
so opioid addiction.
Yes, addiction in general.
Okay.
Any sort of addiction. And including food addiction.
Okay.
So it helps with the craving. So there are a lot of studies about that, and then so it's been added to our compound as monograph because it comes in a powder form, and then it's not readily made. So compounders like me, we are able to put it together and then tailor make for a particular patient. Okay. So that's about NAD. It's also being studied for Parkinson's disease all over the world. So yes. So and then of course the chronic fatigue syndrome that deals with the weight management and all that. So that's NAD.
So I heard it's able to control anxiety and depression too.
Yeah, studies are ongoing for that too, because we've seen positive results for anxiety. And so people are being given that, and then we've seen positive results for anxiety.
Okay, great. So, guys, we talked about a few of the vitamins. I know Doc cannot talk about all of them, because when we list the number of vitamins that are available in this world, we can never finish talking about them. But one thing that has always been on my mind, I've had questions, I know, men are usually not so interested in this, but in our woman world, we've always asked this question. Glutathione.
Right.
I mean, apparently it's like the holy grail of beauty, and all over, a lot of people are using it for skincare purposes. You use glutathione and then your skin lightens up. So what's the deal? You don't need creams anymore to lighten up. You just use glutathione and then boom, your skin. And you're looking like,
Before I go to that, There's this drug. Viagra was being studied for something.
Yes.
And then they realized that the side effect was for erectile
Dysfunction.
it used to cure erectile dysfunction. So it became a drug for erectile dysfunction.
Cool.
So glutathione was originally meant to help people like cancer patients, and then also for HIV patients and people who really need to boost their immune system. But we found out that it was also blocking melanin. And so these patients were becoming lighter, and then their skins were getting brighter, and it was glowing more. So it looks like people have actually jumped on this side effect of glutathione, and then pushing a lot of doses, and then using it to lighten their skin. So it does cause that, but the original aim is to help. Is to help.
Sorry about that, guys.
The original aim is to help sick people regain their strength and health, and then make them look better, because some of these side effects of some of these diseases and the side effects of some of these drugs can be really harsh. It can make them look really, really bad. So it's really meant to make them look better, and not really for the skin per se, but of course people are using it.
In our conversation, you said that even with the cancer and AIDS patients, glutathione gives them a glow, a boost. So that means that it actually naturally makes people look good, right? But then for a healthy person like me, I know glutathione is already in the body, is already a natural thing that's already in the body. I have a certain level of glutathione in my body. But if I choose to use glutathione to lighten my skin, is there a point where I can be having too much glutathione? You know, like, how would I know that I'm not putting too much glutathione inside my body? Trying to be light, because trying to be light, I probably have to use a lot more dose. Yeah.
Yeah, so far the studies that we've seen, people have been pushing a lot of glutathione. We've not really seen any crazy side effect for those who are trying to lighten their skin. But we try to minimize our glutathione. We want to tailor it to the patients, our clients, whatever they need. Because as you grow, your natural glutathione levels drop. And then what we intend to do is to actually top up so that you get to that youthful level. So we try to do it as safe as possible. But yes, I mean, people have been taking advantage of the other effects of glutathione to lighten their skin, just like they did for Viagra anyway.
I think that with a lot of us who live under the sun, hyperpigmentation is a big problem for us, and so this glutathione being able to clear that hyperpigmentation is a big deal. I don't know about somebody trying to be like as white as they can. I mean, that's everybody's personal problem. But if I have hyperpigmentation or skin discolorization, and I don't have to use any cream on the market that, and I have to use glutathione, and I can have that inner glow and even tone skin, then sign me up.
if you have hyperpigmentation, we have dermatologists in our team, and then if you need a higher level of glutathione, if the dermatologist decides that that's what you need, that will be decided by the doctor.
Okay.
Right? But we don't want individuals.
Can I just take a little? If not to lighten my skin, just to get a glow, just to get that glow. I mean, not necessarily to take a high dose to lighten my skin, but can I always maybe once a month to get a glutathione boost?
So everybody has their goal. So when we get a client or a patient, we assess their individual needs, and then we do what we can do for the patient based on safety. We don't want to just be giving people anything unsafely. So it's we have dermatologists that will take care of that and then make sure that whatever goal that you want to reach, you get there safely as possible.
Great.
Like glutathione is a very good molecule, and then it does a lot of good things in the body. And just that we don't want people to be pushing too much into the system.
Okay, good. So one last thing about the glutathione before we move on to the next thing. I've heard, I've seen, when you go to Las Vegas, beside every club, there's an IV infusion where, they give glutathione for hangover, So it's like, people go and they either do the glutathione before they go clubbing or they do it after the club because they have to go to work the next day and they don't get hangover. Is that really like the deal?
Alcohol is worse than glutathione. Okay? Alcohol does very, very bad things to the liver. Okay. And so when you've drunk alcohol and it's done all the bad things, in Las Vegas and then all the other places that you're talking about, they use glutathione to mop up all these oxidants. Okay. So that's why we call it antioxidant. Okay. It just mops up all these oxidants so that you don't feel as bad in the morning. So they will add B vitamins too, and then they will add vitamin C, and all this help to minimize the hangovers and then the bad feelings that you get out of that.
Okay, so does it mean like the liver processes the alcohol faster, and then it gets, when you take the glutathione, does it mean that the liver kind of processes that? Because I know like alcohol kind of sits in your liver and then glutathione sits in your liver too. So
when you drink alcohol, it's supposed to be broken down. For instance, I am a very slow acetylator. Okay. What I mean by that is that I don't break down alcohol well. Okay. So it sits in my system. So for 3 days, I can be having the hangover effect. Some people, maybe 6 hours, depending on your biology. Okay. Some people break down alcohol. Some people can just get up and move. Yeah. But for me, if I want to shorten my 3-day hangover, glutathione can mop up all these bad alcohol molecules,
kind of like
right. That is
speed up the metabolic system, and then
right. So it mops up. It just speeds up like a 7,000. So it just mops up all the toxic and then just take it away. Right. Otherwise, it will be sitting in your system. It will take a long time for it to clear. That's me. So I can. So glutathione is worse than alcohol. So glutathione fixes alcohol.
Oh, okay. So I feel like
and the vitamin C.
You create the problem and then you get the fixer.
Right. And then also, I think that when you drink alcohol, it also affects your vitamin B levels too. So that's why we put in vitamin Bs, all the various forms of vitamin B.
Guys, don't drink alcohol.
Right.
It's not a good thing.
And then also we add vitamin C just to boost you up.
So one last thing. This has been an interesting conversation. I'm sure we've all learned a lot from this, and it's always important that you speak to an expert before you take any of this. Now, what we've seen around is that, it's mostly common here in Ghana, and I'm guilty of it. Self-medication. I've done it all the time. Like, I go to Google and I'm like, Google, can you tell me what did it take? What does this medicine do? Right. Do you think that this all this IV vitamin and all of that, do you think people should actually go to an expert and then get, a recommendation before they start doing the IV, or, the IV infusions that are on the market that people just pick up and then find somebody just infuse it themselves? Some people are able to put in a drink themselves. Do you think that is?
See, the vitamins itself are just very safe. Vitamins, you need them. The danger is when you're putting in the vitamins into your blood by IV, and that you need experts. the compounders should be certified.
Okay.
They're supposed to put it together in a sterile manner. And then the nurses that are given to you should also have all this aseptic, they have to be aseptically, trained in order for them to put it in your system. And then we monitor. We have a doctor and then a pharmacist and a nurse taking care of you. We monitor for side effects. And then anybody can probably have some reaction. I mean, food can even give a reaction. So in case there's any reaction, you need to have a team around that and actually take care of all these reactions and then do whatever that needs to be done for you to be okay. So this IV therapy is not something that you can just go anywhere. You have to make sure that whoever is giving it to you is properly certified by any of the health institutions in the country. And then you have to make sure that the person compounding is also approved by the health, the regulators in the country. So you cannot just get up and go to any spa or anything just to get an IV. No, there are a few certified or properly accredited institutions that are allowed to give IV infusions, and those they have a doctor, they have a pharmacist, they have a nurse, and they have all their SOPs, and then they're doing it aseptically. They have all the emergency procedures in place, and then the emergency cards in place just in case anything happens to you. Mm-hmm. So most of the people that are probably operating underground do not have all these things in place. So if anything happens to you, you'll be the one that is losing. So you have to make sure that you go to a properly accredited institution that is allowed to put these in. No course, these drugs are not. They are vitamins, but the process of putting into your blood, we need to assess you and then make sure that it's done safely, and then you need proper healthcare professionals to do that for you.
Okay. What about this overall safety of the whole IV? Because let's be realistic. You're able to go on Instagram, on Google, and order all these IV. Just order it online. Some come from China, some come from Philippines, and even right here in Ghana, you can get some. You can get some from Nigeria. How do you know what you're putting into your system is the right thing? How do you know if some guy somewhere is not putting powder in something and cooking it up and giving to? How do you know if it's the right thing?
Especially the IVs that are coming from all over the places. We have IVs, glutathione, IV this, IV that are coming that are not FDA approved. So you have to make sure that you have an FDA approved product, which I probably haven't seen any glutathione that is FDA approved. So what we do is we have compounders that are.
Come to think of it, before you continue, I actually came to find out that compounded medications like IVs, IV vitamin infusions, are not supposed to be sold across the border. Like if you're in Ghana, you can't sell, if the IV is supposed to be made in Ghana and used in Ghana.
Right.
If you're in the United States, you cannot import, you can't import or export your IV infusions because it's not really FDA approved. It's supposed to be tailored. So it's supposed to be made by the compounder specifically to the hospital or clinic that is using it. So it's not supposed to be exported. So how come we're seeing all this imported?
People are buying unapproved glutathione from all over the places. So the proper way to do, in fact, in the USA and then other jurisdictions, they compound it, and then these compounded products are tailored to the patient, and so they are not allowed to be shipped across borders. Mm-hmm. So I as a compounder, if I want to tailor make any IV therapy for a patient, I first of all have to be approved by both the FDA and the Pharmacy Council.
Okay.
And to be allowed to bring some of these things mainly from the USA. And it has to be an USA approved, US FDA approved product from an approved manufacturer. And so they bring it to me, and I have to compound it until I make it for the patient.
So guys, when we
Right.
say compound, it means the process is actually making the medication or making the product. So when a compounder say a compound, it means that you buy the raw materials and then you make the product. So the finished product is what is not supposed to be exported, but the raw materials can be exported. So now that's what he meant by he imports from the US. So now what we are talking about is that we find that we already have finished product on the market, which is not supposed to be so.
Right.
So if you find yourself buying a finished compounded product, that means that it was one way or the other illegally brought into the country, and
Right.
you cannot, you cannot fight it if something bad happens to you.
Right, you can't, because you don't know. You cannot trace any of these companies that made these finished product.
Okay.
Every finished product has to be approved by the US FDA or the Ghana FDA before you can use it.
Okay.
But we as a compounders, we can bring in all these ingredients and then put them together for any patient. In fact, I don't compound for only Premier. I compound for a lot of hospitals, big hospitals.
This time you were working with Rage and
people,
UGMC and all of that.
one or two things that I compound for pain, for everything else, not only for vitamins.
Yeah.
So we put together these. First of all, you have to be properly trained.
Okay.
And then you have to use sterile conditions and then put together these compounds in a sterile environment for the patient. So from the time you compound it till it gets into the patient, there has to be all these sterile protocols followed.
Okay.
So the nurse are also trained to make sure that they do alcohol swabs on the patient, and so that these things don't introduce any microorganisms into the patient. That is the key. Okay. That is what other people might be doing. I don't know whether they're trained or not.
Okay.
That you have to make sure that whoever is doing this for you has sterile training, background before you allow them to put anything. So the key here is you might put in, first of all, an unapproved product, and then secondly, microorganisms into your system if it's not done by the appropriate professional.
That would be dangerous. So my last question, I keep saying my last question, guy, because I'm trying to get him to answer all your questions because he probably is not coming back. So what is the worst thing that could happen in an IV vitamin D infusion? We know vitamins don't have side effects and all of that, but just in case, what's the worst thing that could ever happen?
Okay. Yeah. You can even go to a restaurant and eat something and then you can be allergic to it.
Yeah.
People have allergies. So when you come, you want to make sure that we take all your history and make sure that you're not allergic to any of the components that we give to you.
And guys, don't lie about your medical history. Most of you do.
Exactly. So, but in case somebody doesn't know that he has some allergy to anything, we are on standby to make sure that in case there's any allergic reaction, we take care of the patient right away.
Okay, so there's there's a protocol for if you have an allergic reaction.
Yes,
that is great.
Yes, we have standing protocols.
Great. That is important because if you actually go to an unapproved place and have your IV vitamin and you have an allergic reaction, it's a very dangerous thing, and you're supposed to have a medical professional on standby to give you a medication to get you intact before the ambulance or whatever you go to the hospital. So always make sure that wherever you go and do your IV vitamin therapy, make sure that there is the protocol for allergic reaction. Okay, Dr. Afari, thank you for having this conversation with us. It's been a very interesting conversation. We've learned a lot, and we appreciate you taking your time to go through all of this with us. And I'm sure if you guys have any questions, you will leave your questions in the comment section below. And then in our next Premier Talks, we probably would take your question as one of our topics. So thank you, Dr. Afari.